Welcome to The Explainer. So, have you ever really stopped to wonder why babies born early face such absolutely immense medical hurdles? I mean, why is premature birth so dangerous? Today, we're going to dive right in and unpack the actual biological realities of it all. We'll discover exactly why those final few weeks of gestation are literally vital for a baby's survival. Okay, here's a quick roadmap for our explainer today. We'll start with the clinical definitions of preterm birth, look at the causes and risk factors, dive deep into the biology, and wrap up with the short and long-term impacts, finishing with a quick summary. Let's get to it. Starting off with Section 1, defining preterm birth, and looking at the global scale of the issue. So, what exactly counts as preterm? Well, a full-term pregnancy usually runs between 37 and 41 weeks. According to the World Health Organization, any delivery before we hit that 37-week mark is officially considered premature. It's a strict biological threshold, really, because before 37 weeks, the baby's systems just aren't quite finished cooking yet. And just look at this number, 15 million. That is a staggering figure. It represents how many infants are born preterm globally every single year. To put that into perspective for you, that's 11% of all live births worldwide. No way around it, this isn't just some rare anomaly. It's a massive public health challenge that impacts literally millions of families. But not all preterm births are created equal. As you can see broken down here, an infant born extremely preterm at less than 28 weeks is going to face vastly different and honestly far more severe physiological challenges than a moderate to late preterm baby born at, say, 35 weeks. The timeline really matters. Moving right along to Section 2, causes and risk factors. Why does it actually happen? Right, so if those final weeks are absolutely crucial, why do so many pregnancies end early? Well, it's kind of like a giant complex puzzle for doctors. But generally speaking, we can divide the triggers into two distinct pathways. The first pathway is spontaneous labor. This happens naturally and often totally unexpectedly, due to things like carrying twins or maybe fighting off an infection. The second pathway, though, is what we call iatrogenic delivery. Now, these aren't accidents. They are calculated, medically initiated early deliveries, like a C-section or induced labor, specifically done to save the pregnant person or the baby from life-threatening danger. For instance, inducing early delivery is often the literal only cure for something like severe preeclampsia, where dangerously high maternal blood pressure creates a really hostile environment. Or if the placenta stops functioning properly, doctors might have to make the tough call that the baby actually has a much better chance of survival in a NICU incubator than staying inside the womb. Okay, let's get into Section 3, the biology of prematurity, or what happens when development gets interrupted. When we map this fetal development out on a timeline, it is wild how drastically survival rates change. Before 24 weeks, survival chances are incredibly low. But then, by week 28, that rate suddenly jumps to roughly 80%. That massive leap happens because of a very delicate window known as the age of viability. It's the exact threshold where the fetus's systems develop just enough to make survival possible outside the womb with intensive care. And the absolute biggest hurdle during this viability window? A little substance called surfactant. Babies born before 24 weeks simply haven't produced enough of it yet. You can think of surfactant as a sort of biological lubricant for the lungs. Without it, the tiny air sacs just stick together, making literally every single breath an immense struggle. And hey, it's definitely not just the lungs we have to worry about. The third trimester is a period of massive, rapid brain development. During these final few weeks, the brain is quite literally wiring itself. It's growing rapidly in overall size, separating into distinct left and right hemispheres, and taking on the adult-like features that are absolutely necessary for both basic survival right now and long-term cognitive function down the road. Now, on to Section 4, short and long-term impacts. What are the actual consequences of early birth? Because these complex biological systems get interrupted, the immediate dangers tend to snowball into long-term hurdles. For instance, the super delicate, underdeveloped blood vessels in a premature baby's brain are highly prone to rupturing, which leads to brain bleeding or intraventricular hemorrhage. And tragically, those early brain bleeds can cause lasting conditions like cerebral palsy or lifelong cognitive and visual impairments. Another huge complication is gestational diabetes. Imagine being a fetus bathing in an excess of your mother's glucose. Your tiny pancreas naturally starts overproducing insulin to handle it all. But if you're born prematurely and suddenly cut off from that massive sugar supply,
All that excess insulin can throw your newborn body right into dangerous hypoglycemic shock as you desperately try to adapt to the outside world.
Ultimately, we're seeing the profound effects of what researchers call fetal programming. See, a lack of oxygen or nutrients in the womb essentially forces the baby's cardiovascular and nervous systems to adapt just to survive the moment. But the catch? These early survival mechanisms get permanently programmed into their biology, leading to a much, much higher risk of chronic diseases like cardiovascular issues deep into adulthood. It's a lifelong impact. Let's bring it all home with Section 5, Summary and Takeaways. So, to pull this whole explainer together, preterm birth is any delivery prior to 37 weeks. It can be triggered spontaneously, or it can be medically induced for safety. Biologically, it severely interrupts vital lung maturation, like that crucial surfactant we talked about, and brain wiring. And the impact? It causes immediate respiratory distress and can lead to serious long-term neurodevelopmental issues. Basically, those final weeks of gestation are not just about the baby plumping up and gaining weight. They are an absolutely critical biological finish line. Which leaves us with a really important question. With 15 million infants facing these severe risks every single year, how will advancing prenatal care and new biomarker testing change the future for our most vulnerable babies? The medical community is racing to figure out how we can predict and prevent early labor before the damage is done. Until we unlock those answers, understanding the incredible biology of fetal development highlights exactly why every single week in the womb truly, truly matters. Thanks so much for joining me for this explainer today.